So this one's from Patricia. Thank you, Patricia. And this is about EL, who's female and 30. And EL is overweight. She has skin irritations, mood, is short-tempered, sometimes gets abdominal bloating. She also has a lost sense of smell and has been seeking medical attention, and all tests are negative or treatment doesn't work. In her teens, she began having issues, didn't know if it was her junk food diet or what it was, but doesn't really recall exactly when she lost sense of smell, sometimes in transition of middle school to high school. And she tried gluten-free but didn't feel different. Let's earmark that. She's an omnivore, says she eats too much, is very social, and drinks socially. She works out 2 to 3 times a week in the gym or cardio kickboxing, and walks a lot in New York City. She's not taking any supplements. She's not taking any medications. So main questions for discussion. Knowing that everything is about the gut microbiome. You guys are awesome. What type of testing needs to be done here and by whom? So I'd be curious about the baseline tests that she's done where everything comes up negative, and looking at those through a more functional lens. So if you're in New York City, you may want to look for a functional doctor there who knows how to assess the tests that are being done. There's a difference between pathological levels in regular old serum tests and functional levels. And we need to be looking through that functional lens, not for a diagnosis, because it's the pathological levels that tell us whether there's a diagnosis, but instead for the functional levels, which clue us in to where things are in optimal and could be contributing to the signs and symptoms. And there's quite a lot here. And there's a name for losing the sense of smell that I'm totally forgetting right now, but I have worked with a little girl with that, and really we want to look at food sensitivities for that. So inflammation and food sensitivities are key. So after regular serum testing, which is going to include your a CBC, so all your white blood cell markers, your immune markers, a metabolic panel, I'd be looking at thyroid because of her weight, so a full thyroid panel. I'd be looking at inflammatory markers like a C-reactive protein, homocysteine, vitamin D, really looking at those levels. And one thing we do in full body systems, I don't teach you lab analysis, but I teach you the functional ranges within the context of what we're learning, so you can do this detective work. Again, as nutrition professionals, we are not in the role of diagnosing. We cannot diagnose, but we can gather information and dig deeper and be detectives. And that's really what I like to teach you to do. So that's where I say it's not about knowing the answer, which is like if you have a diagnosis, you do this. It's more about how we think on our feet and work with the information. And the way I use labs and lab diagnostics is to gather more information. So for her, I would want to see a regular old full serum panel to start and make sure that I actually thought everything was okay there, including thyroid, because of what seems like resistant weight loss. And I might also then, as a next step, look at IgG food sensitivity testing. I'd want to see that before doing any next testing. So I find, and this is different than a lot of functional practitioners, a lot of functional MDs will do all the testing up front. So it's thousands of dollars, $6,000 for doing all that testing. I find, first of all, that I want to have the client be able to work with a practitioner that is going to bill their insurance, so it's going to be a better cost savings for them. And then let the next test lead me to the next test that I need, because there's so much functional testing we can do and invest in, but I want to make what I think is the right decision to give me the next bit of information. Now, we noted that this client drinks, she has bad moods, she went on a gluten-free diet and didn't feel better. So here's where it may not have been enough. So gluten-free is still going to be important. So I'd have to work with that person to get some buy-in and learn a little bit more about their experience with gluten-free. Did they go on a gluten-free high sugar diet using gluten-free goodies all over the place and that didn't work? Or what didn't work? What does that mean? Because I would want to explain how that would still be another first step. And I'm not gluten-free crazy, I'm anti-inflammatory crazy. So we have to think about inflammation as a bottom line. I keep forgetting to set my little alarm here, and as we all know, I can go on quite a bit about one case because it's all so interesting. So really creating some relationship with this young woman who has a lifestyle where she wants to get out, and understanding the pain point of these signs and symptoms that she's experiencing to see where we might try again. Now, this is a person who may very well do that 3-week kind of deep dive I was talking about to clear the muddy waters, so doing an anti-inflammatory protocol that includes gluten and then the possibility of reintroduction. And you know, there's some reintroductions that I just wouldn't do, but it's a way to get some buy-in so that you can see what kind of results are experienced, because once somebody experiences a change, they're in a different situation to have this important conversation with you. So that's first and foremost answering the testing, and part of that testing is an elimination protocol. That's what lets us see what works, what doesn't. So also, next question from Patricia is, how can we help her to get to the root cause of her sense of smell being lost? And from the research I've done, and again, I'm forgetting the name of the condition, this is where we want to look at anti-inflammatory, and I would definitely look at the food elimination, and then potentially what I like to do is IgG food sensitivity testing as a next step. That would be the next step. Besides probiotics and possibly L-glutamine, what should she be taking or doing to restore better microbiome balance? So I think, Patricia, that this is another one of those situations of really backing it up, and instead of thinking about it as a microbiome imbalance, thinking about it as a situation of inflammation. The mood tells us there's inflammation issues, the resistant weight loss, and even the loss of the sense of smell. So thinking about it through that realm and backing it up, instead of thinking about I need to restore the microbiome, thinking about there's some inflammatory situation here. How do I clear the muddy waters and see what resolves from there? So that's how we back it up. Like, what is still an issue when we actually do that cleanup and that clearing? So that's where I'd be starting with her and see what comes from there. And in terms of supplements, I'd actually be thinking about bringing in some probiotic-rich foods to start. So really thinking about bringing it into her food. And then also B vitamins, the B complex, because there are mood issues, and the B really helps with liver detoxification, so it's helping with the whole way in which we process what's happening in the microbiome. But because there's mood issues and I'd want her to feel better faster, B vitamins, essential fats, and probiotics through food would be my first steps.